Hi everyone, my name is Dr. Christine Anderson, and I am a chiropractor that practices in Los Angeles. And my specialty, my niche in my practice is pediatrics and pregnancy. And I've been doing this for over 30 years and absolutely love helping families grow up healthy. So I'm coming on tonight to talk about colic in chiropractic because this is one of the most common issues with newborn babies and infants that presents to pediatricians. And medically, they're really quite limited in what they can do. So we're going to talk about what is colic, what are the symptoms of colic, causes, how chiropractic can help with colicky babies, and the studies on chiropractic and colic. And believe it or not, there are many of them. So let's just dive right on in. So first of all, what is colic? Well, in 1954, the Dr. Wessel came up with the rule of three. And he said that if a baby was crying for more than 3 hours a day, more than 3 days a week, for longer than 3 weeks, then they probably have colic. And it occurs really in about 10 to 40% of otherwise healthy infants, so approximately on average 20%. And that means that they don't have any other major health issues going on. They haven't been diagnosed with a particular disease. It peaks at about 6 weeks of age. It occurs equally in boys and girls, and there's no correlation if the baby is breastfed or bottle fed. And it generally resolves within 3 to 6 months of age. Now, infantile colic is actually classified as a functional gastrointestinal order. Boy, that is a mouthful. And it does occur in about this, these functional gastrointestinal disorders occur in about 50% of infants. And usually they have more than one thing going on with their GI tract, with their symptoms. So this can be part and parcel for what is going on. And we're going to talk a little bit more about the connection between chiropractic and the GI tract in just a little bit. Okay. Here we go. All right, so what are some things you might see in a baby who is experiencing what we term colic? As I said, it's a diagnosis of exclusion. It's really not descriptive of what's going on, but basically what you might see are some of these things like pulling the legs to the chest. So the lower body is involved versus just the upper body. If a baby is hungry, it tends to just move the upper limbs, not so much the lower limbs. There's a little bit more going on in the lower body when there is discomfort, possibly in the GI tract, but it's one of the things you might see with colic. Continual crying. As we said, there's that rule of threes, more than 3 hours per day. And in general with colic, it is usually in the evening, in what we term the witching hour as parents. It is, it's continual. You cannot calm the baby. You cannot distract the baby. There's nothing that stops them from crying when they have colic. So let's go on here. Whoops. Sorry about that. Sleep is short, so they have trouble with sleeping. They tend to have maybe sleep for about 20 minutes and then they'll wake up from their sleep screaming and crying. They're not comfortable on their back, so they won't sleep on their back. They don't really want to lie on their back. A lot of times they'll start arching, and they prefer either sleep on their stomach or their side. And as far as eating, they won't eat for long. They'll start to eat, and then they kind of pull off the nipple or the bottle and they're uncomfortable. They might wiggle around. They might have trouble settling in. They also can scratch at their face and pull at their hair in their discomfort. Now, I also see this when I have babies with issues with their cranial system, and there might be these things going on related to the colic. So, it's it's like really the chicken and the egg, which comes first, and you're going to learn more about that in a second. They might have issues with their GI tract, so things like constipation, a distended belly, painful gas, which may or may be related to the colic or any other GI upset. Sometimes they have reflux as well, so there's often a lot of things going on. So with the causes of colic, there really is no known causes. There's not one thing that's, oh, it's this thing and this causes colic and we can take care of that thing. It's not known. So like I said, it's usually a diagnosis of exclusion. We're not finding any major problems. There's not this going on. There's not that going on. And remember, medically, they're looking for disease and disorders and not necessarily looking at function. So the medical community proposes maybe there's some GI immaturity or cramping or inflammation, so something going on with the gut. Poor feeding technique, which could mean that they're taking in a lot of air. Casein and lactose intolerance, which are proteins and a sugar in milk that can irritate the gut if you are sensitive. Altered gut microflora, so that's the beneficial bacteria in the gut. And there's also a connection between possibly maternal smoking. So here are some proposed causes, but there's not just one thing, and it could be a combination. And these are just some things that they think might be a reason for colic to occur. Now, I contend another major cause, I would say this is the number one cause, would be vertebral subluxation. So that's a little teaser. I'm going to talk more about that in a second. Let's talk a little bit about the consequences of untreated colic. So if colic is just supposed to disappear by 3 to 6 months, and you say, okay, well, it's going to go away anyway. I'll just tough out the crying because they're going to, quote unquote, outgrow their colic. So what is the harm? Why should we worry or why should we be concerned about helping a baby with colic? Well, here are some things to look at. First of all, continual crying is stressful. Babies cry for a reason. They are hungry, they are tired, or they are in discomfort or pain. So if your baby's diaper's changed and they've been fed and there's no thing sticking in them, then why are they crying? They're trying to send you a message. I am not comfortable, mom and dad. I need some help. And so this is the only way that they can do it is by crying. So it's stressful for their bodies. Stress hormones will get released. That will create more discomfort and pain, and that cycle will go on. It's also, colic is linked to postpartum depression. Well, go figure, your baby's crying. Being a mom and a dad of a newborn is not an easy thing in the first place. And then if you have a baby that's crying that you just cannot help, then if there are any imbalances going on with mom, it could really tip her over into postpartum depression. And even taking that further, it's actually one of the major causes of shaken baby syndrome. So this is where the baby is shaken from the shoulders and the head kind of whiplashes forward and back because newborns cannot support their head, and the brain catapults inside the skull and it can do major damage. So a baby's crying, you're at your wit's end, and you're you're not in your right mind. This can happen with parents that no way would they say, I would shake my baby. It also can be the precursor for child abuse and neglect. Because again, if you are, let's say a mom is suffering from postpartum depression, she's already having a hard time, the baby is crying, not consolable, not being able to be helped medically, she might end up neglecting her baby and just kind of putting them in the crib, closing the door and being like, I can't deal with this. And that certainly can create a deficit on parental bonding in a very, very crucial time. Parental bonding for the baby and the baby to the parents. And there's been some studies done possibly linking to colic to behavioral problems in the child later on. Again, this can be a reflective of what was going on between the parents in the early period, not getting the emotional support the baby needed, and or the actual cause of what was going on, possibly in the nervous system, setting up that development for later on. And there can also be lower academic achievements. Another thing is this, all right? Just because the baby stops screaming doesn't mean the problem goes away. And if there are issues with the intestinal system, those can continue on throughout life, and the child might be at risk for chronic abdominal pain and other digestive issues, constipation issues, even leading on into adulthood. These are things that could have started out early on in life, and this could be in relation to what's going on with the nervous system, which we're going to talk about. There's also been some information about an increased risk in migraine with babies who have had colic and not received any treatment. So let's talk about the common interventions for infantile colic. There was a 2020 review study that was done, and this is very interesting because they looked at the benefits of 3 interventions. Number 1 was probiotics. Number 2 was manual therapy, including chiropractic. And number 3 was drug therapy. So there's certain drugs that they've tried to use, and there was actually no evidence that the drugs helped to decrease the crying time. The probiotics actually helped reduce crying time between 30 and 60 minutes a day. And the manual therapy helped reduce crying time between 33 and 76 minutes per day. And more interestingly, this was independent of the parent's awareness of whether the baby was actually receiving treatment. So this takes out kind of the placebo effect, if you will, because parents, of course, are monitoring the crying time. And so this really does indicate that there was something that the chiropractors were doing that was actually making a difference in the child's crying time, because the babies, they really don't know what's being done to them. So it would just be the parents. So this kind of graph type of thing on the left with the white background and the 3 groups on there, 1, 2, and 3, is from the study looking at the manual therapy aspect. So group 1 got the chiropractic care, the manual therapy, and the parents were aware that the baby was actually getting some treatment. Group 2, the babies got their chiropractic care, but the parents did not know whether they were getting the placebo effect or the actual adjustment. And then group 3 was the control group, no chiropractic, and the parents didn't know if they were getting the treatment or the placebo. So you can see from this graph that group 2 did the best for decreased crying time, the amount of time in a couple of weeks. And group 1, the ones that the parents were aware they were getting chiropractic, also did well, but both were about the same. But group 3, the control group, fared the worst. So this is really a great study showing that there really is a difference. Chiropractic does help. And I want to go through a couple of other studies just really quickly. There's a number of them, and in the description, I'm going to put the studies and the links for these, as well as some other ones that I'm not going to specifically talk about. But there were some case studies, etc., that showed that chiropractic did make a difference for babies with colic. So there was a prospective study of 316 cases, and there was a significant improvement in 94% of the cases with chiropractic care. That's amazing, but chiropractic is amazing. There was a study of 104 infants, and chiropractic adjustments significantly improved their crying behavior. Parents reported few hours of crying per day with chiropractic in another study, and over 2,000 mothers reported improvements across all aspects of infant behavior. That means feeding, sleeping, crying, pain, that type of thing, with chiropractic care. And the babies that did not get chiropractic did not experience the benefits in some of these studies where they had a control group. So why does chiropractic work? What is it about adjusting the spine and working with the cranium as well that helps with colic? Well, it all comes down to the nervous system. The brain and the nervous system controls every single function in the body. And so if there's any interference to the communication between the body and the brain and the brain and the body, things are not going to work so well. And in general, symptoms will come up because the body is not able to function, and it will send you signals like, hey, we need some help here. Now, specifically with colic, there is an area that is the connection between the neck and the back of the head. So it's right at the top of the spine. When you put your hand on the back of your head, it's that little indent right at the bottom of your skull. And it's the connection between the skull and the upper neck. And this is a crucial area because this is where the brainstem is. Now, the brainstem is where babies operate. It's the foundation of the brain and brain development. And this is where one cranial nerve comes off called the vagus nerve. There's 12 cranial nerves. This is number 10. And it comes off the brainstem and it travels all the way down to the heart, the stomach, the small intestine, the large intestine, the pancreas, the liver. I mean, it goes all the way into the gut. Is the direct communication and connection with the gut and our brain. It's pretty incredible. I believe vagus means wandering nerve or something like that. It is super long. But if there is anything that goes on, let's say during the birth process, this is a very vulnerable area because that brainstem sits right in the hole that is in the skull that exits out into the spine. So if that baby is not lined up properly and the head isn't tucked in, let's just say their head's extended or rotated in any way, it's going to put possibly some compression or pressure back there. Some vertebra might go out of alignment. Or let's say there's a hands-on intervention with a vaginal birth and the doctor comes in, puts the hands on the baby, and is tractioning on the head. That leaves an opportunity for that first cervical vertebra in the neck to go out of alignment and create a lot of issues, including with the vagus nerve. So this is why our bodies will show us there's something going on here. The vagus nerve is part of the autonomic nervous system. It is the parasympathetic portion, which is the brakes on our system. It's what we call our rest and digest. So go figure where it goes out to a lot of the digestive organs. And so if there's compression or problems there, you may have an imbalance between the sympathetics and parasympathetics, meaning that baby is in a stress state. The sympathetics are the gas pedal. It's the one where we're like fight, flight, or freeze. We're in panic mode. And so it can help create the imbalances with the autonomic system as well, heightening that stress response, heightening the crying and the screaming because they are in distress. So with the adjustments, as a chiropractor, we're going in specifically looking for vertebrae that are not moving properly, that are stuck out of place, that are misaligned, that are restricted, as well as the cranial bones in someone who does craniosacral work, which I do. With chiropractic, there's some moves as well, some adjustments to be made with the occiput to free up the nervous system so that that flow can occur again, and then the body can normalize, optimize its function, and then the baby doesn't need to cry because there's no reason to cry. Everything is calmed down, everything is functioning, there's no irritation, there's no restriction, and what do you know? The baby does not have colic symptoms anymore when this occurs. And it can happen in a very, very short period of time. So there's no set, there's no set thing for this. It's on a personal and individualized basis. So I can't say, oh, I'm working for everybody. I'm working on these levels and it takes this amount of time. But in general, when you look at the studies, these babies are having results in very, very short periods of time. Sometimes 3 adjustments, sometimes within a matter of a couple of weeks. So it isn't a very long process. If you're on the right track, you're going to see the results right away. All right, so I hope you enjoyed my presentation on colic and chiropractic. That is my website up at the top, losangeles-chiropractor.com, where you can reach me. I do gentle chiropractic. I am board certified in chiropractic pediatrics. If you're not in Los Angeles and you want to find a chiropractor who is versed in pediatrics, I do recommend you find one who is at least certified in pediatrics. That's at least a year additional training. Board certified is 3 years. And I also do craniosacral therapy. I'm also a homeopath. I do a lot of integrative care and looking at what else people are doing in their life. So I'm also looking at mom and helping with breastfeeding and what she's eating and nutrition and that type of thing, because it does matter. And I do look at the diet and the formula, because those could be factors in irritating the gut when you are trying to work with a baby with colic. So I hope you enjoyed this. Like I said, give me a thumbs up if you found this helpful. It really does help this video get out there, because think about how many kids, how many families are suffering with a baby with colic if they are crying. Remember what I said about the consequences of untreated colic. We know that the studies are not showing drugs are working. So if people are just seeking traditional models of care, they're going to be missing out on this opportunity. So please help me in spreading the word. This is my mission, is to help as many families, help as many kids as possible, so that nobody has to suffer, and then everybody can have optimal health and grow up healthy. So thank you so much. Subscribe if you haven't yet, hit the notification bell, and I will see you next time.